Hey guys, so today we'll be going over some medications in therapy. The first medication we'll be going over is for pain, and this is acetaminophen. The generic name is acetaminophen, but the brand name is generally Tylenol, and it belongs to drug classes of analgesics and antipyretics. An example of why a patient would need this is if the patient reports mild pain in the right hand and fingers due to osteoarthritis. Acetaminophen can be administered orally via pills or liquid, rectally, or through an IV, which is intravenous. A study found IV to be less effective than other routes. However, the oral route is fast and effective, while intravenous is immediate and has higher peaks. The exact mechanism of the drug is not fully known. However, it's classified with NSAIDs because it acts the same as it inhibits cyclooxygenase. A major difference between it and NSAIDs is that acetaminophen has no peripheral anti-inflammatory effects. Inhibition of cyclooxygenase pathway is what causes the prostaglandin production to be blocked, and this induces the analgesic and antipyretic effects of the drug. Contraindications include severe liver disease, and it should be reduced if a patient presents with renal disease. Studies have looked at links between birth defects and mothers taking acetaminophen, but it is considered safe for pregnant women. Adverse side effects include rashes, skin reactions, nephrotoxicity, and blood disorders, including anemia and leukopenia. It can also cause imbalances in blood with metabolites and electrolytes. Other effects seen only with IV are nausea, vomiting, constipation, pruritus, and abdominal pain. Anaphylactic reactions have been seen rarely. Even more rare are reported cases of pneumonia. Acetaminophen can react poorly with warfarin and alcohol, and it can worsen the effects of other liver diseases. The medication is the #1 cause of acute liver failure. This drug could impact physical therapy evaluation as it can dull pain, so patient-reported pain might not be accurate or might be inconsistent from visit to visit. PTs should be aware of the signs of adverse effects associated with the toxicity of this drug. It will be beneficial to know when the patient is taking acetaminophen, as they will most likely be more able to exercise due to feeling less pain in the affected areas. Watch for signs of disorders caused by this disease, including neutropenia or leukopenia. If any are observed, be sure to report them to the treating physician immediately. During treatment, it will be beneficial to educate patients on other ways to decrease pain that will allow them to take less medication. It will also be beneficial to educate the patient and family on signs of the disease, as well as what to avoid, such as alcohol or other NSAID use while taking acetaminophen.
Alright, so now we're going to be going over naproxen, which is a drug that can help treat inflammation. So the generic name of the drug is naproxen, but it has multiple brand names, which include naproxen, Anaprox, and Aleve. And this belongs to the drug class of non-steroidal anti-inflammatory drugs. So an example on why a patient would be prescribed this drug would be if a patient reports to physical therapy with inflammation in the right knee due to patellar tendonitis. So this drug is considered the first-line defense for certain diseases such as acute gout, osteoarthritis, musculoskeletal pain, inflammation, and dysmenorrhea. It is also used secondarily for diseases such as rheumatoid arthritis and ankylosing spondylitis. And this drug can also be used effectively for migraines and migraine prevention. So for the administration, there's 2 ways it can be administered. One is orally as a pill, and it has immediate or slow release pills. And the other way is topically. If it's taken orally, it's recommended that you take the drug with food, milk, or antacids. And for all NSAIDs in general, it is recommended to take the smallest dose for the shortest duration, if possible. And as for how this drug works, what it does is it blocks the arachidonate binding, which inhibits the cyclooxygenase pathways, which then lowers the prostaglandins in the blood. And the lower prostaglandins is what allows for the analgesic and anti-inflammatory properties to occur. And naproxen has been shown in several studies to be most effective at inhibiting the sensitivity of peripheral pain receptors. So some of the adverse effects for this include dyspepsia, nausea, dizziness, increased blood pressure, rash, bleeding, ulcers, and lowered renal function. Some of the more rare effects include myocardial infarction, stroke, heart failure, and anaphylaxis. And these effects are generally all due to the lowered prostaglandin numbers throughout the body. So an absolute contraindication for this drug is pregnancy, and especially if it's 30 weeks or later. And it is recommended that you don't use this, or you use lower doses if your patients have recent myocardial infarction, hypertension, congestive heart failure, edema, dehydration, gastrointestinal events, bleeding, hepatic or renal disease, tobacco use, if they are elderly, or if they have asthma. Now, as for physical therapy and how this would affect us, like acetaminophen, so patients taking this might have a pain rating which varies from session to session. So it is important during the eval you assess the patient's range of motion and strength in order to evaluate if the drug is impacting the patient and how much it is impacting them. It is important to take the patient's vitals and check for fast heart rate and respiratory rate, as these can be impacted. During treatment, it's important to be aware of potential side effects such as bruising, edema, and fatigue. If any of these signs or effects are observed, it should be reported to the treating physician immediately. And PTs should also be aware of the rest of the signs of adverse effects and should work with the patient and the patient's family and or people with them in order to watch for the signs and let them know when to report any of the signs to the physician. And now we're going to go over doxycycline, which is a drug that can help your body fight infection. So the generic name for this drug is doxycycline hyclate, and the generic name is also often the brand name with this specific drug. Another name it can have occasionally is monodox, and this drug belongs to the class of tetracyclines. So an example of why a patient would need this would be if a patient comes into your clinic diagnosed with a UTI causing pain with urination. This drug would help with the infection with the UTI. So some indications for this drug: it can be indicated by acne, malaria, skin infections, sexually transmitted infections, and Lyme's disease. And this drug has also been shown to have properties that can help patients relieve their rheumatoid arthritis symptoms. So for bacterial infection, the drug is going to be taken orally in pill form, and it is recommended to take it with water on an empty stomach. It can also be taken at smaller doses daily, also in pill form, for anti-inflammatory benefits. This happens as the smaller dose helps spare your body's healthy bacteria, but it also provides the anti-inflammatory effects of the drug. And another way this drug can be taken is if you are traveling to a, say, malaria prevalent country, you can take this drug daily in the days leading up to, and you can take larger doses, and it will help provide anti-malaria effects while you're in the country that you're traveling to. So now how this drug works. This drug is high in lipophilicity, which allows it to cross a lot of cell membranes in order to reach its target cells. So after you take this drug, it is able to cross over the cell membrane of the bacterial cell that it is trying to destroy, and it binds to the ribosomes inside the cell to inhibit the binding of other enzymes to that ribosome. So this then stalls out and forces the bacterial cell to stop producing proteins, which then leads to the cell death of the bacterial cell. So doxycycline is able to present anti-inflammatory effects by inhibiting white blood cell proliferation, which effectively stops the movement of white blood cells towards the injury and lessens the effects of inflammation. Now we're on to some common side effects. And these include diarrhea, photosensitivity reactions, nausea and vomiting, rash, headaches, and occasionally teeth changing color. And some of the rarer and more serious effects include bloody stool, leukopenia, migraines, anemia, chest pains, shortness of breath, fast heart rate, dysuria, and intracranial hypertension. Some indications that you should not use this. So you should avoid taking doxycycline if you're also taking warfarin, as this can increase anticoagulation in the body. It's also important to avoid taking doxycycline if you're pregnant or if you're also taking penicillin or isotretinoin. And you should avoid using or lower the usage if the patient has liver disease, yeast infections, kidney disease, lupus, myasthenia gravis, or colitis. Now, how this impacts physical therapy. Physical therapists should be aware of the signs of adverse effects associated with toxicity of this drug. And this drug family has also been associated with tendon tears and overuse injuries. So PTs must be careful and observant in the prescribed exercises. And exercise and movement can also help patients here, as it can increase the blood flow, which will help with healing. But it can also cause joint pain and inflammation during and after the sessions.
PTs should discuss with their patients the benefits and potential implications of these prescribed meds, and it's also going to be really important to educate the patient and their family on the side effects so that they know what to look for and when to report these symptoms to the treating physician. And after treatment of these patients, it's important to wash your own hands and disinfect any equipment that the patient may have been using, because they do have an infection and it could spread. And something else to watch for with these specific patients is the risk of intracranial hemorrhages. So PTs should avoid anything that increases the blood pressure excessively, and should avoid certain positions such as putting the patient's feet above their head.